Hey Mo,
Are we here? Are we live? Are we on?
we're live. The doctor is in.
The doctor is in, the doctors are in,
Yes,
and this is a day that we have been waiting for and planning for and
yes,
talking about. And it's a question that a lot of women have, and they don't know that they have it until they
right,
realize that there's some piece of information that they were missing. They're like, wait a minute, what?
right,
And then everybody wants to talk about it. At least they should. So today is the day you're going to know your breast density. And if you don't, you're going to have a lot of questions for your doctor tomorrow. So let's
right.
get
And you
into
can't
it.
you can't figure it out like this either, right? You got
Sure
to get
can.
out there. You can't. So we're going to talk all about that. So we have like these guys have been working all day on density day. It's density time, and you know, why don't you introduce yourself, Leslie? You start.
Okay, I am Leslie Ferris Yerger, and I'm CEO and founder of My Density Matters, relatively new, not for profit. We are small, but we are mighty. And today we had our third annual Find Out My Breast Density Day. So go to our social media channels, and you'll see everything that we live streamed and talked about. Look at all the videos, look at the amazing survivor video that we did. And, so we just been out everywhere talking about breast density all day. And so thank you so much for having us on the show tonight, just to kind of cap off a wonderful day and make it even better.
Great, great. How about you, Andrea?
Yeah, hi everybody. I'm so happy to be here today to talk with you all about this really important topic. My name is Andrea Koulis. I'm the Director of Program Strategy for My Density Matters. And today has been a whirlwind of amazing activity on Find Out My Breast Density Day. And we're really just emphasizing the importance of breast density and urging women to take the steps necessary to protect themselves and the women they love, based on their newfound knowledge of breast density and what you can do about it. So really excited to talk to you all today.
Awesome. Awesome. And our bestie, Ashley, our bestie
Thank you.
survivor.
Thank you, Ricky. Hello, everyone. I'm Ashley Dedman. I am a BRCA2 mutation carrier, a supporter of My Density Matters as well as Touch. I have a family history going back to 3 generations of breast cancer, a father who is a prostate cancer survivor. And I'm here today because when I had my baseline mammogram, from finding out that I'm a mutation carrier, I also found out that I have a dense breast, specifically a category C. So I'm super excited to be a part of this conversation. And thank you to Leslie and Ricky for the opportunity to be here and share the patient provider perspective.
And Mo has the opportunity to have our doc on the line with us, our Dr. Sarah, who's on our medical advisory board. She's our badass oncologist. So great to have you here, honey. Uh-oh, do we lose you, Sarah?
Thank you. Thank you for having me. You know I love being here. Oh, can you hear me?
Yeah.
Okay. Okay, I might have to relocate myself if my sound is bad. Can you hear me okay now?
Yeah, we got you.
Okay. All right. Well, thank you. Yeah, no, this is, such a great topic that we don't talk about enough. Changes are coming, so it'll be an interesting discussion about what we can do as women to know what our breast density is and know what should be done in terms of mammogram and screening.
Great. So Mo, we got a great topic here. Oh, well, I think Andrea's going to kick us off by telling us all the activity of the day, right? And
Yeah, I want to ask that question. Andrea, tell us about, or maybe we'll let Leslie tell us the history on why this day got started, but tell us how the day has been, right? Because it's been a day full of Twitter and chats and Q&As and postings, and tell us everything.
The day has been a whirlwind for sure. And I mean, the amount of support from people all across the US, even internationally, has been really great. And the most important thing is that the message is getting out there and people are learning about what this is. Because one thing we have really noticed is that we have to start at the very beginning, because a lot of people don't know what breast density even is. or why we should even care. And I just wanted to emphasize that there are two key reasons. First, women with dense breasts have a higher risk of breast cancer. And secondly, dense breast tissue makes it harder for a radiologist to see cancer on a mammogram. So if you have dense breast, cancer could be hidden on that traditional mammogram. So we'll get into all of that today. And I know, Leslie, you have an amazing story that you shared today on our Survivor Story montage and in your own personal story. So I'll pass it off to you because it's really inspiring and gives the whole story behind why My Density Matters exists.
Well, thank you. Well, yeah, so it could be a long story, but it's going to be a short story, is that I was diagnosed 2 months after an all-clear mammogram and ultrasound with stage 4 breast cancer. And it was just found in a DEXA scan. This was over 5 years now ago. And so y'all know the statistics about that. And you know that I'm lucky to be on this call at all. And I feel fortunate about that. But that was because of my breast density. And I didn't know anything. You know, like breast cancer wasn't really about me or for me. It was for the other people who had it and stuff. You know, like that's kind of what we all do to protect ourselves. I got the mammogram, but, I never really thought that I would get breast cancer, let alone the way it happened. And so, after the diagnosis, I studied what in the world is going on and learned all of this. Largely the two key points that Andrea just made, but that we have a long way to go with getting women everywhere in the world the breast cancer screening that they really need to find their cancer early. So many women are getting diagnosed late. And you all know the later, the worse it gets. And so that's what I'm really all about. That's what My Density Matters is all about. That's what Find Out My Breast Density Day is all about, is getting that word out to people who, like me, didn't know anything about it. And empower them to find out their density and have that conversation with their doctor.
It
That's
brings
what
up
we
a
want.
really good point, So, Ashley, let me ask you, did you understand what breast density was, and at what point did you come to understand what it was?
That's a great question. For me, I just lost my mom to metastatic breast cancer. I just found out my dad had prostate cancer. I was just graduating from college and starting my career in education. And I just found out I carried this gene mutation that makes me at a higher risk than the average woman, who's at about a 12 to 13% risk over her lifetime. And so it was all of this information coming to me at one time. And so when I went in for my baseline or my first mammogram, I just had so many feelings and emotions and confusion and just information, overload, really. And so I really didn't know at the time. It was after my mammogram that I received a letter. It was a letter. It was a full sheet of paper with 2 sentences on it. And it said, "You have dense breasts. If you have any questions, follow up with your provider." And I'm just like, what does this mean?
What does that mean?
And so it was very confusing. It was very scary. And it really just took me talking to my doctor and asking questions as to what did this mean? But what did this mean on top of also carrying this high risk gene mutation that makes me at a higher risk for breast and ovarian cancer? So I think a part of it was just where I was in life. I was young. But then also there was not a lot of information shared when this news was delivered to me. It was very cold. It was very impersonable. It was just a white piece of paper with 2 sentences on it. And so it was just really hard to navigate.
Mhm.
So Ash, go back for a second. So your mom died, your dad was sick. What prompted you to even get tested for BRCA? Did you have your mom had BRCA? Did you know that?
So great question. So my great grandmother, grandmother, and mother all passed from breast cancer. And so what prompted me was after, and I didn't know my family history on my mom's side until after my mother passed away. I knew about my grandmother, but it wasn't until after my mom passed that my dad told me about my great grandmother. And so, you know, I saw a pattern. I knew something was not right. And I think it was fear that prompted me that I was going to be next. And so just hearing that my dad was diagnosed with prostate cancer, both of my parents were educators. And so I knew that I needed answers. I knew that I needed to educate myself. So that's really what prompted me to reach out to my OBGYN and update her on my family history because it changes annually. And that's when she talked to me about genetic testing and genetic counseling based on her knowing about my mother's diagnosis and then updating her on my father and my great grandmother. So that's what prompted me.
Cool. And how old were you then?
I was 21, just turning 22 years old, about to graduate from college. My mom passed about 2 or 3 months before I graduated. So unfortunately, she didn't see me graduate from college.
She saw you. She saw you. And she didn't
She
have
did.
any pain when she saw you. She was there with you on the other side. She got healed on the other side.
Yes, that
So
I
did
believe
you have
that.
to fight? Yeah, for sure. But did you have to fight to get a mammogram at that age?
I did. So when I first went in, I will never forget, I walked into the doctor's office and I showed them my papers, and the lady at the desk said, "Girl, you're too young for a mammogram." And I looked at her and I said, "You know what?" I said, "You don't have the right to tell me that." I said, "I'm high risk. I have a gene mutation that makes me at a higher risk for breast cancer." And I said, "Shame on you." I said, "Because had I been ignorant, not dumb or stupid, but just not informed, I said, I could have walked out this door and not come back until I was 40. And I told her, I said, you are the first person you are the first professional, medical professional that people see when they walk into this office. And you make that first impression and you set that standard of what people should expect." And so she apologized, but I was just so grateful that I knew I carried this mutation and I knew what it meant. And I knew I had to be there.
Right. When you got the letter about dense breast, did you know what that meant?
I didn't. I remember calling my doctor immediately and asking, what does this mean? And I spoke to her nurse, and she had me to come back in so I could talk with my doctor, because not only did we need to talk about my dense breast, but we needed to talk about it in relation to also carrying and having this gene mutation. So initially I did not know. I think I went a couple of days just kind of in wonder. And I think we do what everybody does.
Dr. Google.
We go to Dr. Google, we go to the internet. And so for me, it was, trying to navigate that information, but then also waiting to meet with her to see what the next best steps were for my standard of care.
You get that letter, and it hasn't always been that you would get a density reading on your mammogram, on your letter, right? The patient letter. On the doctor side of things, we get one that says a whole lot of details about what they see or don't see. No suspicious lesions, no suspicious calcifications, no change from prior year. The breast density is the heterogeneously dense. But the patient would typically just get a letter that says everything looks okay, see in 1 year, BI-RADS 1 or 2. Right, with that score of where you are in terms of your suspicion for cancer. It's called a BI-RADS score. Right. Now, in many states, they're required to tell you specifically how dense your breasts are. And you get this little disclaimer, and it says the sensitivity of mammography for heterogeneously dense or greater breasts is diminished. And you're like, well, did it work? I had a lot of patients come see me and say, well, does that mean that my mammogram didn't work because it says I have dense breasts, or my doctor told me I have dense breasts? And it may say category A, B, C, or D, or it may give a number, or it may give a little descriptive about how dense your breasts are. And the medical community as well really didn't know what to do with that information. You know, Dr. Sarah, would you agree that the PCPs and I think the gynecologists, they had a perception of what breast density was? It was textural, but the actual radiographic density is kind of a different story.
Definitely. No, as you're saying, a lot of this knowledge about what breast density is, especially when it is in relationship to prevention of breast cancer and reviewing those images, has been something that's just newly been identified as being, even prognostic of something. So, it kind of makes sense, like you said, the more dense the breasts are, and when you're looking at mammograms, dense means that it's showing up white. The more dense the breasts are, the more difficult it would be to see something that could look like cancer, which also shows up white. And so, as you also said, I think when people thought about dense breasts, they just thought, oh, they're heavy or they feel a certain way. They weren't thinking that, this may impact our ability to really read some scientific information. So now that it's being conveyed scientifically and that there's a push now for the mammographers to actually give a density score, and that density score means something, and that hopefully all of the states, I don't know if all of them have all agreed to do this, but we'll realize that sometimes extra measures need to be taken. At this point, right, there seems to be, most places put a little note at the bottom saying, yes, you have whatever the category of density your breast is, talk to your doctor, you may need more imaging. And that's also a gray area. Some, docs don't know what that means. What do I do? Do I do an ultrasound? Do I do an MRI? So a lot of this still needs to be standardized, but there's definitely a movement to do this. And along with that, there's research being done to try to make sure that whatever we decide to do, it's supported by validated science.
Wow. A lot of women too,
Am I-
say,
Okay.
when I start talking about dense breasts, they're like, well, any people who think they have big boobs think they have dense breasts. And I keep saying, girlfriend, you can't tell by yourself. You gotta get a mammogram. It's nothing, well, mine feel dense. No, that's not the case. Now, chances are they could be, but you need to get checked. You need to get checked. We also know the data shows that if you do have dense breasts, you have a 4 to 6 higher likelihood to get breast cancer. And then if you add what Ashley had on top of that, the BRCA gene, I don't even know those numbers, but you need to be on guard for, and take care of yourself. And even
It's elevated. And Ricky, you bring up a really good point in that, people thought that just having heavier breasts, right, was the density,
right.
but also that you needed to get a mammogram.
You
Right?
need to
You
get a
cannot
mammogram.
really truly detect density on an ultrasound because ultrasound is sound waves. It looks at the breast a different way. And mammograms are x-rays and they look at the density. It's a study designed to detect density, like an x-ray of a leg. You see the bone, but not the soft tissue and the skin. You don't see those things as well. The thickest thing shows up white.
Right.
So the whiter it is, the more density is in the breast, and there are categories of density. And so when I talk to women, when I go to different support groups and other things, or even just educational sessions, I say, how many of you have dense breasts? How many of you know what your density is? The hands go down, and it's a part of the letter that you don't really understand. And so there are 4 categories of density, and we should probably go over what those are, because some people are going to have almost entirely fatty breast tissue, and so that fatty breast tissue shows up darker, shows up black on the mammogram, and that would be a category 1 or an A, or sometimes it'll just say entirely fatty breast tissue. The second category is scattered fibroglandular breast tissue. So you have some fibrous stuff, then you have some glandular stuff, or the stuff that produces milk and the stuff that carries the milk to the nipple. That stuff is showing up white on your mammogram, but it's scattered. And again, I use the TV analogy. I'm old, so I use the console TVs. How much snow is on your TV screen, right? Or how many clouds are in your sky. So if you got 25% cloudy, it's partly sunny, right? But then it goes into heterogeneously dense, like half and half, like 50% or so. And about 40 to 50% of people are going to have heterogeneously dense breasts. Half of it you can kind of see through and you got some static on the screen, but we can still make out the picture. And then you get to extremely dense breast. 3/4 of your screen has static or snow on it, more than 75% dense. And it's really hard to see the picture. If your TV screen had that much static, you might not be able to see the picture as well. And so those are the people, about 10%, 10 to 15, maybe more, have that extremely dense breast tissue. And so then we came up with the 3D mammograms, right? And then you say, who knows what tomosynthesis is? And those 3D mammograms are supposed to help cut through that density because it's like slices through the breast. We get a movie forwards and backwards. But then what? Should you be getting anything else? And Dr. Sarah, to your point, doctors still don't know what to do for extremely dense breasts. The societies have not all come together to make recommendations for what we should do.
Okay. And one thing that Ricky said that was really important too is that when we're talking about dense breasts, and some women think because I'm larger, I might have more dense breasts. When you look at it, breast density is actually the opposite of weight. So usually the larger you are, you have more fatty tissue, and fatty tissue shows up as black or less dense. You can see through it really well on a mammogram. And so actually women who are larger, who lose weight, their breasts become more dense. And so what's left when you lose that fatty tissue is kind of the white, what we call stromal or support tissue. And that's what makes up kind of that density. So yeah, it's kind of, you got to think about it the opposite of weight sometimes. But to someone's point, you really don't know your density. You can't guess, oh, I'm larger, I don't have dense breasts. You need to get the mammogram and you need to get the density actually measured.
Yeah. So Ash, when you found all this out, what'd you do?
So I found out when I was around 21, turning 22. So I began seeing a high-risk oncologist to monitor my breast and ovarian health. And when I met with my oncologist, she talked to me about my risk management options. We talked about increased surveillance, which would aggressively monitor my breast and ovarian health. We talked about hormone therapy. And we also talked about prophylactic or preventative procedures. And I was young, unmarried, no children. And so I knew I didn't want to do anything permanent at that time. And so I did increase surveillance for over a decade. But a lot of knowing my breast density is what helped me to figure out my risk management options going forward. I know during that 10 years of increased surveillance, I felt really empowered because I felt like if something were to develop, I would catch it early. But also having dense breasts, I was called back in several times just to, double check. It was, mammograms, it was breast ultrasounds, breast MRIs, rotationally, to check and double check. And so I was empowered by my decision, but it would be, those days after when you're waiting on the results and you're waiting for the doctor to call or to even have to come back in because they just want to be sure. And so after that 10 years, I had my husband and I, we had our first child and I was able to breastfeed her. But I needed a new course of action. And so I went back to my high-risk oncologist to explore other options. And at the age of 31, I had a preventative double mastectomy to drastically reduce my risk of breast cancer and still do high-risk surveillance for my ovarian health. But that was the best decision for me and my family at that time. And so now knowing that I've drastically reduced my risk in a good portion, not 100%, but a good portion of that breast tissue is gone. I feel empowered by my decision and really believe I made the best decision for me and my family.
And then you had another baby.
Huh?
And you had another baby.
Yes, we had our second baby in 2019, and that was an emotional challenge because we weren't able to breastfeed baby number 2. We weren't able to breastfeed her. So that was an emotional challenge I had to really kind of tackle. But my husband kept reminding me, like, what you did was based on facts, the facts of your family history, the facts of you carrying this mutation, just a lot of the back and forth with my breast density. And so you made an informed health decision that would ensure that you would be here for both of our girls. And so, no, I wasn't able to breastfeed her, but I knew that I would be here for the both of them. And so now it's fighting and advocating for the next generation of girls and women, Black women, to make sure they're aware of not only their family history, but also their breast density, which plays a large part in screening and what your screening and risk management and standard of care should look like.
It brings up a good point,
It's one of
actually,
those
because,
character-
sorry, what's that,
I
Ricky?
said, the second one's a little character, so I don't think she missed out anything.
Love it.
I would
I've seen
agree.
her
I would
dance-
agree.
I've seen her dance on stage, right?
Oh my goodness. Oh, it's precious.
She didn't miss
the-
a beat. She's a healthy baby girl.
Look at that. And she's going to know about her breast health, I guarantee you.
Yeah, yeah.
The guidelines for even when you should have started screening, Ashley, and this is where it gets, Leslie, I want to pull you in too to talk about this, right? Like, what are we doing for women who are at high risk? And because the guidelines for when you should have even started screening, there's two different ones. American Cancer Society says start at 30, right, for high risk individuals. The NCCN, the National Comprehensive Cancer Network, the Bible that most of us use, says start at 25. You went and advocated for a mammogram at 21. And so there's a lot of discrepancy and discordance over even what the high risk screening should be, and whether or not people who have dense breasts are in a category high risk or above average risk anyway. Leslie, I don't know that anyone has ever really even broached that subject with these bodies, of whether or not just having dense breasts we know it's an independent risk factor for breast cancer, but is it enough to put you in that higher risk category?
It depends on who you talk to and which model you use. There are people out there using all different models. Some have density included and some don't. There's a lot of AI activity going on out there trying to estimate, people's risks in a different way. That's kind of exciting too. But as you say, ask 10 people the question, you'll get 10 different answers.
Mm-hmm.
And, throw in, forget the bodies that do the guidelines. If a woman goes and asks her doctor, you're going to get even more answers. And so it's frustrating. So what I was so excited about when I was hearing Ashley talk is that she found out her information, she was empowered, she knew what to do, and she took control of the situation and made decisions based on her life and what she knew. And so that's kind of where we all are right now. Until we get a lot further with all of this, we're going to have to be empowered to make, to enter into those decisions with our doctors and really, really understand and be a part of the solution right now, until breast cancer is cured or there's really very, very good guidelines that make sure that we're all covered when we need to be covered. I don't see that happening for a while, honestly. So I love that Ashley was so empowered to do what she did, even though I'm sure that those decisions were incredibly difficult.
It takes a special kind of personality to do that, though. And, so much of us kind of hide behind the data and hide behind the truth. And so many of our families do, as Ashley did too, do not talk about their history. And so we're surprised and caught off guard when we get breast cancer. So we have to have these conversations. And Mo, I think there's a big question that's in the chat. I think you're answering it about calcifications. Can you ask that question? Microcalcifications, what they are?
Sure. So somebody asked the question, one, are microcalcifications associated with dense breasts? Are they only associated with dense breasts or more so? And the answer is that no, microcalcifications can be seen in women who have dense breasts and also who have less dense breasts. And what they are, they're these deposits of calcium, not like you ate too much calcium, but the cells in the breast get hard. And 80% of those microcalcifications are going to be benign, but there are some studies that are starting to look at whether or not having those little dots, and we're talking tinier than 5 or 6 grains of salt or sugar, having those dots plus dense breasts are maybe comprising an element of risk for women also. So there's some good studies that are starting to come out that's looking at whether or not having those calcifications puts you at higher risk for breast cancer. I don't think we know the answer yet, but I think there are some studies that are suggesting that having those plus dense breasts maybe equals a higher, slightly higher risk for breast cancer. But just having those little calcifications, the radiologist will look at them over time. And Leslie mentioned AI, the artificial intelligence will read that mammogram and look back at the previous ones. And it's why it's so important to get the study every year, because if you miss a year, and Dr. Sarah's going to come in and talk about this too, is it really important to get it every year? But we typically look at changes over time. And so if there's a big gap of time, then are those changes something that could represent cancer? And we don't know the answer to that. And so, all of this points to an imperfect picture to me, Dr. Sarah, and a little bit of confusion among the medical societies, and it trickles down to the level of the patient and that in that exam room, asking those questions like Leslie mentioned, not even the societies, but just talking to your doctor. Does your doctor know what to do for your density and your risk? And what's being done about this?
So you asked a timely question, because anytime there are these unanswered questions, of course, we need to do some type of research to try to figure this out, right? And so there are several studies looking at different things. Some are looking at mammography, and I'll talk a little bit about one of those studies. Right now, the recommendations for a woman to get her mammography is the same across the board, right? It's based on age, basically. Recommendations are you start at an age, usually 40, and then you get a yearly or every other year. But we know that there are a lot of other things impact a woman's risk for breast cancer, including breast density. So the thought is, right now, we have models that we've used for years and years and years and years to predict a woman's risk for breast cancer, looking at things like, your family history and the age that you started your period and when menopause. These things have small impacts on your risk for breast cancer. But now that we have technology, we have genetic information, and we have breast density information, there are some studies that are trying to incorporate these things to make a more scientific recommendation that's more personalized to the woman on when you should start your mammograms and how often. So I work for a nonprofit now called Quantum Leap Healthcare Collaborative, and we house and sponsor different studies. The by breast cancer neoadjuvant study, but it's a health research group, but it's also affiliated with a lot of investigators from UCSF who are doing research in breast cancer. So one of their big prevention studies is called the Wisdom Study, and it is it's interesting and interesting in a good way, is because it's a study that a woman can do from her phone. I mean, digitally. You don't have to go in anywhere. You can enroll in it, and you can follow up and do all the steps through either your computer or your phone. But in a nutshell, it's a study that is looking at women who are at an age of breast cancer. So age 40, I think, to 75 is where we go. You get genetic analysis based on spit, looking at markers of risk for breast cancer that we know. You also get the same information that we already use in terms of determining your risk. They also incorporate breast density into, among other things, into determining a more accurate model, and then give a recommendation on when you should start your breast cancer screening, be it 40 or be it 50 if you're a low risk person, or if you're at higher risk, the recommendations would be to because you're 40 theory, when you enter this study, nobody would have a recommendation for earlier, but the recommendation may be for every 6 months of screening, may add an MRI. So all of this will let us know, based on scientific information, is it appropriate to have this type of screening for women, and what type of things are indicators for higher risk. So that's just one study that's actually looking at, how we can better screen women. But it does include breast density. I was talking to one of the investigators about breast density, because right now breast density is not necessarily required from all 50, I think it's like 38 states right now that require. And there's a push now to regulate this and standardize what is written on a mammography report. And so I know that I see you, Leslie, shaking your head. You probably are waiting for the FDA to come out with that update, but the FDA is either sometime this year, beginning of this year, supposed to come out with an update to their breast density notification regulations that are going to help push the states, all of them, to require that they not only report it, but they report it in a standardized ways with the same categories you talked about, Dr. Mo, those 4 categories. And then again, hopefully insurance companies will see this. They won't give pushback on doing extra imaging for those who are sick. Exactly.
Right. So
Okay.
Dr. Sarah, I was looking today actually at the Wisdom study, and do you have to be 40 to join it?
So now, the reason I'm hesitating is that there was a push to decrease the age to 30.
We need to for Black women. We need to be younger.
And that is happening. So they're finishing up all the 40-year-old category, and they're starting, and we're starting this year. And I'm not sure if it's open yet, but if not, very soon, starting at 30. So we'll have a 30 to 39 category.
Because I was telling Haley and Emily and Christine that they needed to join it today, and they came and said, Ricky, we can't. I'm like, no, we're going to fix that. I'm going to talk to Dr. Sarah about that.
I think that's huge, because all of
Oh
the
yeah.
studies,
Oh yeah. No, tell them.
yeah, all of the studies that look at whether or not we should screen Black women earlier, all say more data is needed, additional evidence is needed, because they cannot conclude that starting earlier screening would result in, 1, detecting more cancers, and 2, decreasing mortality. They can't say it for sure, and that's because the question hasn't really been directly asked or evaluated. And I think that that would be a really powerful arm of the Wisdom trial. I want to talk about messaging and how do we get the message out about breast density? Like, what are some of the things that you all did today, and why did you choose to do those? How's your social engagement been, and what's the best ways to reach people about these things?
Yeah, I think one of the things that we did that I think is going to be very impactful is we created what we called an action item quiz. So essentially, any user of any age with any family history can go in and input their information, and it will spit out an action item with some resources and guidance on what to do. So, if you have missed a mammogram, for example, that's a simple one. Go schedule your mammogram. If you've already gotten it and don't know your density, check your chart for your breast density, and we've got resources on how to talk to your doctor about what to do next. So I think that's really powerful, because there's a certain age group. For example, my age group is under where you would traditionally go get a mammogram. And if you don't have a family history, you're just kind of sitting there wondering, what am I supposed to do? But this will give action items to literally everyone who takes the quiz, whether they're 15 years old with no family history to 70 years old and beyond, of course. So I think that's going to be really impactful, because it's super simple. You don't have to know anything to get in there. And we also created an educational message, which is extremely simple. It's kind of based on a cartoon. You just watch these little people going about their business, and you get all of this medical information distilled into a really, really simple presentation, again, with no requirement to know anything going into it. So I think just starting at the very beginning and assuming no knowledge is going to be the most important step to communicating breast density, communicating why it's important, and trying to help people figure out what action to take.
That's right, because you don't know anything when you get diagnosed with breast cancer, when you get a, genetic understanding, you don't know anything. We don't know, how would we know that? Right?
Yeah. And one thing that I found really interesting throughout the day is that a lot of people think that breast density is rare. They've kind of been like, oh, I don't know anyone with breast density, and I didn't even know what that was. But half of women just about have dense breasts, and it's even higher in certain segments of the population. So it's totally normal. It's not anything rare, and it's affecting a lot of women. So it's very surprising how many people don't know about it, given how many people it does affect.
Yeah.
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 So
Mm.
just to carry a little bit on from what Andrea said and to address further, Dr. Mo's question about how are we trying to reach people? Well, we rack our brains about that all the time. And so this year, we tried a bunch of different new things. And, all the way from really serious survivor stories, which is doing well right now, I think, on social media because it is so impactful and so real. Those ladies were amazing.
Right.
But then also we're doing a fun social media challenge. Like, I'm going to take care of my breast health and find out my breast density day. And I publish mine because I want to play with my cat, and hashtag cat lovers and all that kind of stuff, so it's a little unorthodox, a little not normally done, but you have to find creative, different ways to reach people with the information. And so, we tried those things this year, and I think it's going to work. We'll learn a lot, but do the social media challenge.
Well,
And why can't it be fun? Why shouldn't
No,
it
why
be fun?
shouldn't it?
Absolutely.
Yeah.
Exactly. I mean, this is such a serious subject that sometimes people are like, oh, like, I don't want to talk about it. It's cancer, but if you can talk about it in a slightly different way, maybe you can still get the information across that people will actually take action with in a new creative way. And that's what we've tried to do today.
Well, one of our hashtags is be iconic. So it's okay.
Oh,
do
yeah,
something
love that.
differently. Like,
Yeah.
I think, we all do this work every day. And if we keep doing the same thing over and over again, we're never going to get rid of it. So we got to do things that are crazy and off the cuff. And, if it means wearing a pink bikini on a tutu and
Yeah.
whatever.
Well, when I saw the study that said literally a third of women know what density is and everybody else doesn't, and I'm like, all right, we need to do new, different, interesting, creative things.
Right.
Because, why not? Why not?
Right.
Clearly what we're doing right now isn't working 100%. So,
And if you think about it too, think about the women that got that letter. Thank God they got a mammogram for one thing. And then they got the letter, but how many really acted on it? We find so many, the data shows that even when we know we're at risk, we don't act on it. We don't talk about it. We don't go back and ask the doctor because we're busy trying to save the world, trying to save the kids, trying to cook the dinner, trying to do the homework. And we don't do it. And we don't do anything to take care of it and to take the time that Ashley did and the energy and the focus to say, okay, I'm going to take control of my life. I'm going to be my girl boss. I'm going to be the CEO of my own health. And I'm going to do something to protect my children. Hello. And we just don't all do that because we're busy or we're scared or we don't really know what to do. And there's a lot of big words being talked about. And what does that really mean anyway? And until you sit down and really think about it and ask and be intentional about your health, we're going to keep, having bad outcomes.
And to your point, Ricky, we have to normalize the conversation. I just think about even when if one of my girlfriends were to pick up the phone and said, we're just talking and, she's like, yeah, I'm headed to go get my mammogram. I think that's a great time to, talk about, that's a great time to bring it up and to, normalize it. If you're having coffee or you're getting a mani-pedi or you're just riding in the car together, and you're talking about these things, it's being intentional that when we're talking about our health and talking about mammograms, that we talk about breast density. And a lot of the questions may be, well, what is that? And it's providing resources like My Density Matters and sharing their information to be able to further guide and educate, and then also empowering ourselves and our breasties and our friends and men to, when they're talking to their doctors to, have further conversations until they get the answers that they need and they feel comfortable.
Can men have dense breasts, docs?
They can. Yep,
I
they
would
can.
imagine they can.
Um,
They just don't have as much.
Go ahead, Dr. Sarah, what were you saying?
Can you, yeah.
Yeah, I was just saying, I would imagine that they can have dense breasts. They have, less breast tissue overall, so it's maybe a little more difficult to identify. You can imagine how difficult a mammogram is on a man. It's like we all have, or women who have had mammograms, and the more breasts you have, the easier it is. But I would imagine the same would hold for men as it does for women, though. You just have to get the imaging.
When
Yeah.
we do see men with dense breasts, though, a lot of times it's associated with what's called gynecomastia or excess breast tissue in men, right? And there's a sign on mammography called like a flame sign. You see a lot of dense breast tissue behind the nipple, and it can feel lumpy, and it can feel like dense breast tissue feels on a woman. That's how it can feel on a man. So, when there's a lot of it, it's more concerning. It probably should be checked out, and may require some more routine follow-up, because there are really no screening guidelines for men, and so even a man who has some density doesn't necessarily have to get screened every year. But if there's a change, and if it's asymmetric, especially, they got to follow that up. So, we definitely want to encourage men to get into this conversation as well, because, men do have breast tissue. Everybody's got at least 2 sets of mammaries, sometimes more. We see that, you can have multiple nipples and dense tissue in lots of places. I've seen dense tissue in the axilla, breast tissue in the armpit, and cancers can start there. So knowing that exam, I think, is really important. And I feel sad that we have gotten away from encouraging people to do self-examination out of fear that they're going to scare themselves or get unnecessary biopsies. I don't think telling them not to check is a good substitute. But that seems to be where we are with things, I think.
Yeah, but also I think knowing if you have a family history is so important, because it's likely that men who did get breast cancer have the gene, have a BRCA gene. So,
I have a question. And it just, Dr. Mo, you said something that made me think of it. For maybe specifically to me, but just maybe or even a woman who has had a mastectomy. If she has dense breasts, and once that breast tissue is removed, I know, speaking for me, my surgical oncologist said, we can't move 100% of the breast tissue. I still have the tissue around my nipple area and under my my lymph, like in that lymph area under my armpits. So I was thinking the other day, I'm like, I know I don't have any more breast tissue, but what does that look like for someone like me? Like what does that look like? I still have a little bit of tissue, but how does that play into the conversation today? I hope I asked that question right.
I think you did. And what I tell my patients is that separating that layer of fat underneath the skin is a thin layer of fat, and then there's the breast tissue, and it's like separating a Jello pudding cup, right? Like you could take a spoon and scoop off that vanilla layer, and you're looking at the chocolate, but there still could be a little bit of vanilla under there, and that's the breast tissue that remains. There is no recommended screening once a mastectomy has been done. There's no routine screening that needs to be done, because the amount of breast tissue or the few cells that are left, you would theoretically be able to detect them on what's called the clinical exam, right? So twice a year, you're getting an exam. They're teaching you what you feel and teaching you what they feel and going over what you feel. MRIs, when there are implants, maybe every at least 3 years, and at the 10-year mark or so. But there is no more routine imaging for people who've had prophylactic mastectomies. And so it's so important to know how your lymph nodes feel and when do they feel enlarged. If you get a COVID vaccine or something and you feel it feels a little bit thicker, you got to know your changes, because there is no routine screening, but it's because the risk of a cancer is so low, and there's no more breast tissue left to compress to look at anymore.
Yeah, I know, one of the things that we're trying to do, Ash, in our new For the Love of My Girls campaign is to normalize checking your breasts. So instead of thinking about cancer, make it an act of self-care. So check your breasts when you get your nails done. Check your breasts when you go to lunch with your girls. Check your breasts when you call your mother. Check your breasts when you call your girlfriend. Check your breasts when you wash your hair, something like associate it with something that you like to do, or that's a self-care act that you take when you do a facial. Check your breasts. So then it doesn't become an association with illness, but an association with Black breast health. And that's a lot of what we're talking about, to know. Leslie got bumped out. She's coming back in. But we want people to check their breasts, because we want you to know you're normal, and have, think about it, talk about it. I mean, even, my first mammogram at 40, they found calcium deposits on my breast, and I ended up having surgery to remove them. But no one ever told me I was at risk for breast cancer. At Northside Hospital in Atlanta, no one told me that you have a higher risk. So it never even fazed me. Stupid me that I didn't get that. But I think that it's all in how we're educated. It's all in who talks to us. So that's why, we scream from this pulpit that we have on Wednesdays. Thank you, God, for Black doctors, that we can do that and hope to get, messages out that are going to make a difference for people. But
wanted to tag on a little bit about from what you said about talking about breast density as well. One of the things, because I'm an oncologist, people ask me about cancer all the time, but one of the things that I've asked people to do, and I know that I tend to do, and people think I'm crazy, but when we're in big groups, especially big groups of women, be it your organizations, be it your family reunion, be it wherever, your girlfriends, we talk about mammograms now, and it's not a scary subject anymore, and we just add breast density on. I mean, we know, and the 6 of us, and now hopefully people listening to us, the importance of it. But I think if we just add those in, and even just bring it up de novo and from a meeting, I just wanted to, this word will get out like mammography has, the importance.
yeah.
I love that, Dr. Gordon. I think you're absolutely right. We got to normalize those conversations,
Yeah.
So Leslie, how do people normalize this conversation? I mean, it's not like you go out with your girls and be like, girl, what's your breast density? Like that. I don't think that's ever come up at one of my lunches, but what do we want people to do from today with this knowledge? What's your hope?
My hope is that wherever they're at, make the next move. And I just think big picture, if those who need a mammogram get one, those who got a mammogram don't know their density, find out their density. Those that know they're dense but haven't gotten additional screening, get it. Like, if we could just shift the whole thing, one move.
Yeah.
I mean, I want cancer to go away. I mean, of course, that's like,
But
in our conversation today, if we could just go from here to here, think what a difference that would make.
That's so true. Just a little shift, because
A nudge. Everybody do one
a little
thing.
shift. Yeah, if everybody do a little shift, and we do a little shift, and you do a little shift, and we sort of, pass it along to our friends, then we can make a difference. And that's how things happen. I mean, that's how Obama got elected, because everybody gave him $10. Right. But how do you take these little messages, these little things, and just build on top of each other and talk to your friends? And, I see young women talk about everything. We talk about everything with each other, and, all the men think we're all telling these secrets about them, but we do talk as women, right? We do talk as women, and that's the great thing about women. I mean, I think we have more breast cancer advocacy groups than any of the disease, because it's mostly us, right? But talk about this stuff. Talk about it with everybody. Don't make it something that you hide from, and talk about it with your mama and your grandma,
And your daughters.
and your daughters.
Mhm.
Yes.
And I
That's
think
what I was
one
just thinking
point
about.
that a doctor made today in one of our videos was, don't think that if you have dense, dense breasts, that there's something wrong.
Right.
I mean, it's just an anatomical thing. It's not bad. It's just something that you need to know about. And I think sometimes maybe we do inadvertently send the message that, like, oh, it's a really bad thing if you have breast cancer. But I mean, it's half of us, as Andrea said before. So, like, just know it.
Just know. Too bad when you buy a bra, it doesn't have like a flash in it that says you have this.
Good idea, though.
In the
I know.
future.
Right.
It's a good
Right.
idea. I like it.
Right.
One thing to know about, just in general, about breast density is that as we age, especially once we go through menopause, our breasts become less dense. So one of the things to know, when you're younger, you just have denser breasts. Estrogen and all those hormones help to keep the breast dense. So when you go through menopause and you lose that, breasts become more fatty. We all kind of lose a little of that perkiness, and that's less dense breasts. So if you are postmenopausal and you're taking hormonal therapy, though, that might increase the density of your breast as well.
That part, I think people don't know that, Dr. Sarah, and that you need to sing that a little bit louder, because there are individuals who are taking, estrogen replacement. I think we don't yet know the impact of things like bioidenticals or some of those other estrogen-like hormones on breast density, but it's a really good question to ask your doctor. Is this going to increase my breast density? Is this going to increase my risk for breast cancer? And make sure that you know that full family history, because, we got enough risk factors as it is, being a woman and getting older, couple that with family history and all the other things you can't prevent. You really do want to focus on the preventable risk factors. And Leslie, I love that you said, not to villainize your breast density, right? You got the density you
Right.
have. You got the genes you were born with. You
Okay.
got whatever,
Yeah.
whatever God gave you, but knowledge is power.
Right.
Yeah. It's like the
Yeah.
boobs
Some
that
of
you
us are
have.
tall, some of us are short, like we're all different. And that's the beauty of people. But it's so we are what we are. Just need to do what we need to do about it.
Yeah. Some of us have big boobs. Some of us belong to the itty bitty titty committee like I do.
And take the quiz and know your breast density, and like get involved with this. The wisdom trial, you don't have to have cancer. This is a clinical trial that you can be involved in where you don't even need to have cancer. And everybody thinks that clinical trials are just for people who have a condition. This is not. This is for you and you and you too. And we want people to really to get this information so we can figure out what to do about this, because the scientific community, we're still trying to figure it out, but you can certainly help with that. And we need, especially women of color, to stand up. We need those women with that breast density to be a part of this trial. We need each and every person to be counted in this trial, so that we can really truly understand what to do to personalize breast screening, because that's the least of what we deserve as women.
Yeah. Yep. I just put my email in the comments. So if you have questions, and we'll connect you to these lovely, brilliant women and whatever you need.
I love that that the wisdom study is doing what it's doing, because we stand in a lot of confusion right now. We talked about that before, and it's murky out there.
Yeah.
And we empower women to go talk to their doctor about their breast density, and they should, but sometimes they get shut down because there's no standard, right? And this is what Dr. Horton and her people are trying to do. And so if we can get there, let's get there.
Yeah. Yeah.
So it's
Well,
not so confusing.
Well, you all have just reminded me too. So if anybody is interested in anyone in the wisdom study, the site is www.thewisdomstudy.org.
And I put
So
it it's in the comments.
Thank you. And so just like it's something that you can do, you don't have to, like Dr. Mo said, anyone, you don't have to have breast cancer, you don't have to have high risk, it's any woman. And you don't have to go somewhere. You can do it just from your computer or from your phone. And it's an ongoing study, and you get, what I love about it is you get some genetic information that belongs to you. It doesn't go to anybody else, but it gives you real information about yourself that may be helpful in the future.
Yep. And I'm putting mydensitymatters.org also in the comments, so you
Thank you.
can reach out to these brilliant women.
I think that's
Wow.
perfect. What we're doing next, Ricky, not to cut you off, but we're going to continue. We're having an after party over on Instagram. And if you want to meet us over there, we're going to recap the day, highlights of the day, funny stuff we saw, and take some more questions because we've had some questions about other types of imaging as well. And we didn't get into that today, but what are some of the other types of imaging that we should do for breast density? And what are some of the new ways in 2023? There should be something more than x-rays, right? To look at breasts. What are we doing to move the needle to really lean into this topic? So we're going to continue the conversation on Instagram. The Instagram handle is
At
My Breast Density.
At My Density Matters.
My Density Matters.
Density Matters.
I'm
I'm
putting that in the
I
chat.
put in the comments.
Oh,
Joyce,
thank you so much, Ricky.
join Dr. Mo.
Yep,
And
meet us over there for the after party.
We'll see you there.
great.
Wow.
Thanks for coming today, you guys. Thanks for sharing your wisdom. Thanks for sharing your story, Ash.
My pleasure.
Thank
Thank
you,
you.
everyone.
This is great.
Thank you for the opportunity to come onto your show.
And
Thank you
thank you. Yeah, My Density Matters. If you get a chance, go to their Instagram, follow them, get a chance, give a donation, get involved, do a post, take the quiz, and really share it widely. You know, we should be talking about this not just today on
Right.
Know Your Density Day, but tomorrow and the next day, and really talking to your families and your doctors about it so that you can use it as a tool and not just stop the conversation at, oh, well, I know mine. But now what are we going to do about it?
Do about it. What are we gonna do about it?
Yeah.
You know, no,
Wow.
next week we're gonna celebrate another breast cancer day, triple negative breast cancer day. So
Yeah.
a lot to
it's
talk about.
Really important.
so much.
Gotta save ourselves. So thank you, guys.
Oh, we hope
Thank
it's been
you.
relatable and reliable and real. That's what we set out to do every Wednesday night on blackdoctor.org. We're thankful for the platform, for the sponsors, for the guests, for the people viewing. And Ricky, thank you for you. We're thankful.
Grateful for you, Mo. All right, love you
Thank
guys.
you, everybody.
Bestie love.
See you on Instagram.
Bestie love. See you on Instagram. Bestie love.